So you might have heard in the media recently a lot of things about trauma. You might be wondering, well, what exactly is this thing called trauma, and what does it have to do with me? Now, the statistics say that 1 out of 10 people in Canada will suffer long-term, like lifelong, from the effects of trauma. And 2 out of 100 have experienced some effects of trauma for at least a month. This is a growing area of real concern in our society. So what is trauma? The way I think of trauma is anything that overwhelms our brain, where our usual methods of coping just don't work anymore. Very often what happens when that happens is that we have to just take that experience and throw it in a closet as if it didn't happen, close the door, and move on. Over time, however, if we keep doing that, which is only supposed to be a short-term coping mechanism, it accumulates and then we can't get anything in that closet. So what kind of trauma are we talking about? There's little t trauma and there's big T trauma. Little t trauma is those things that happen as we're growing up and as we move through life that, like I said, our brain just can't handle, or maybe they're so emotionally packed that our brain can't let go of it. When we are in danger mode, something's going on that is alarming or upsetting, like you're 8 years old and your dad just walked out the door and you're not sure if you're ever going to see him again. Those things can overwhelm our brain, and that's what we call traumatic experience. And then those memories get locked in our brain along with all the different details attached to it, and it keeps us in danger mode. So for example, later in life, you may be very confused in relationships or very hesitant in relationships. You're having some difficulties connecting with people, and maybe it goes back to that first trauma, little t trauma, where you're not quite sure if they're going to leave you, like your dad left you. Now there's big T trauma too. That's what most people think about when they think about trauma. They think about the train wreck or the auto accident, or violence, or sexual abuse, or witnessing violence. And those things, of course, create huge symptoms because that traumatic memory is stuck in our brain. And anytime we're reminded of it at all, sometimes, in fact, a lot of times, that experience will come back like it just happened. And then we have flashbacks and intrusive thoughts and nightmares. We're hypervigilant. We're looking all the time for the next danger. We may have anxiety or panic that we don't even understand. Sometimes people find that they get locked in their houses because the world just seems like a very scary place and they don't know how to get beyond that. The good news is that whether you're suffering from little t trauma that's affecting your life in very subtle ways, or big T trauma that's affecting your life in huge ways, there are ways to get your brain unstuck from this experience that's connected to the danger system. So we have a lot of powerful methods to, first of all, help you manage that arousal level. It's either going to be too high, always in fight or flight mode, or it's going to be too low, in the freeze mode, in the numb mode, in the dissociated mode. So first of all, we have to learn how to manage that arousal and create that calm and safe place in your brain so that we can work on the trauma. So when working on the trauma, we have other things that we can use. We can use narrative exposure therapy that some therapists use. My favorite is EMDR, or eye movement desensitization and reprocessing. This is a powerful technique to help your brain get unstuck from that trauma experience that's causing all those symptoms in your life and help you get to the other side, where we can now retire it, we can put it in overdone, in the past. I know it happened, but it doesn't have to affect your daily life anymore. And so we can get beyond that and get back to you.